everyone. I, Dr. Nitesh Kumar Jain, Associate Professor and Principal, Diploma in Pharmacy, Oriental University, Indore, prepared this lecture under the valuable guidance of Dr. Suman Jain, Director SOS in Pharmaceutical Sciences, Jivaji University, Gwalior. I will cover very interesting and learning episode of B.Pharma on the important unit of Autacoids. This is very important unit of the section of Pharmacology 2nd, 5th semester. Outline of this lecture are as follows. We will cover this lecture under following modules. Module 1st, Autacoids first, it may include histamine, 5-HT and their antagonist. Module 2nd, Autacoids 2nd, it may include prostaglandins, thromboxins and leukotrienes. And module 3rd, it may include angiotensin, pentagastrins, cholecystokinin, bradykinin and substance P. Before going to start a different module details, first of all we will discuss about the definition and classification of Autacoids. What is Autacoids? Autacoids, the term is derived from the Greek word that is autos, self, akos means healing substance or remedy. They are also called endogenous substances with biological activity. They are also known as local hormones because they are not released or stored in the glands, not circulated in the blood, formed at the site of action, produce localized action. They have also been called local hormones. However, they differ from hormones in two important ways. Hormones are produced by the specific cells and are transported through circulation to act on distant target tissues. Autacoids are involved in a number of physiological and pathological processes, especially reaction to injury and immunological insult. Some Autacoids in addition serve as a transmitter or modulators in nervous system, but their role in many sites is not precisely known. Dear friends, now we come to the classification of various types of Autacoids. First category is biologically active amines. It may include histamine and serotonin. Lipid derived Autacoids, it may include eicosanocytes, prostaglandins, leukotrienes and thromboxins. Vasoactive polypeptides, example kinins and angiotensin. Endothelin, natriuretic peptides, vasopressin and substance P. Endothelium derived Autacoids, the best example is nitric oxide. Dear friends, now we are discussing module 1st, Autacoids category first. We will discuss in detail about the histamine, 5-HT and their antagonist. Friends, histamine is presented in high concentration in the skin and in the mucous layer of the lung, and GIT as an Autacoid. At cellular level, it is found largely in mast cells and basophils. Non-mast cells, histamine occurs as neurotransmitter in CNS. In mast cells and basophils, histamine is located in intracellular granules together with heparin. Histamine is released from mast cells by a secretory process during inflammatory or allergic reactions regarding antigen and antibody reactions. The secretory process is initiated by a rise in intracellular calcium level that you can see in the figure number 1, components of allergic reactions in detail. Now we are talking about the synthesis of histamine. Decarboxylase histidine converted into the histamine. Now we will discuss about the occurrence. Tissue exposed to an external environment, GIT, lung, tissues, skin and brain, stored in mast cells and basophils. We will discuss about the metabolism of histamine. So, monoamine oxidase MAO, diamino oxidase or histaminase mechanism of action may include H1, H2 and H3 receptors. In H1 receptors coupled to phospholipase CYP3 and DAG, smooth muscles, it may cause contraction of bronchi, GIT and uterus except blood vessels. H2 receptor basically stimulated adenylyl cyclase enzyme and increased cyclic AMP in heart, positive inotropic and chronotropic effect. Stomach, it is responsible for acid secretion. Now we come to the H3 receptors, that is G protein coupled receptor, presynaptic site CNS, and inhibit release of other neurotransmitters. Now we are discussing pharmacological action of histamine. It is basically cause contraction of smooth muscles, bronchi, uterus and GIT. In CBS, it causes vasodilation of blood vessels, increased capillary permeability, that is called edema. It may also cause tachycardia, cardiac stimulation due to H2 receptors, dilation of cerebral vessels, headache, histamine, cephalgia. Exocrine glands stimulate gastric secretions, stimulation of sensory nerve ending including pain and itching. In skin, triple response we can see, that is redness, vasodilation of capillaries, wheal, that is also known as edema, flare, stimulation of sensory nerve endings. Now we are discussing about the H1 receptor blocker, that is also known as antihistaminics. We come to the mechanism of action first. They are competitive antagonists for H1 receptors. Pharmacological effect you can see in H1 receptor blockage, they block histamine effects on smooth muscles and blood vessels. Atropine-like actions, dry mouth, urinary retention, and you can also feel tachycardia as a side effect. First generation produce sedations and hypnosis. Second generation have little or no sedative action. Antiemetic action, motion sickness, antipertension effect also we can see with these drugs. Now we are discussing about the first generation antihistaminics. Classification. Number 1, ethanolamine, diphenhydramine, doxylamine as sedative and antiemetic, piperazine, maclizine, cyclizine as antiemetic, phenothiazine, promethazine as antiemetic, alkylamine, chlorpheniramine as cold and allergy OTC. Now we come to the miscellaneous drugs. It may include cyproheptadine. Now we are discussing about the pharmacokinetics of antihistaminics. They are well absorbed orally, well short duration of 3 to 6 hours, widely distributed, penetrated in triple B, metabolized in the liver. Now we come to the side effect, that is may induce sedation and drowsiness, antimuscarinic effect, alpha blocking adverse effect, excitation at high doses in children. Now we come to the second generation of antihistaminics. Examples are fexofenadine, fexofenadine cetrazine, loratadine, loratadine tafenadine, estimazole and acribastine. Advantage of second generation over first generation are as follows: cannot cross triple B, no sedation, less atropine-like actions, longer duration of action but more expensive. Uses of antihistaminic: allergic reactions, rhinitis, hay fever, mild asthma, conjunctivitis and urticaria. Chlorpheniramine second generation mostly used in these type of problems. Antiemetic in motion sickness and vestibular disturbances. Promethazine and cyclizine. Sedation especially caused by promethazine. Now we are discussing about the H2 receptor antagonists. Examples are cimetidine, ranitidine and famotidine. This is a very interesting category as far as acid secretion is concerned. Uses: inhibit gastric secretions, cytochrome P450 inhibitors, only cimetidine, treatment of peptic ulcer. Dear friends, now we will discuss about the module second, that is serotonin, also known as 5-hydroxytryptamine. Serotonin was the name given to the vasoconstrictor substance which appeared in the serum, which blood clotted and intermined to the smooth muscles contracting substance present in the interchromophin cells of gut mucosa. In the early 1950s, both were shown to be 5-hydroxytryptamine, that is 5-HT. About 90% of body's content of 5-HT is localized in the intestines. Most of the rest is in platelets and brain. Now we are talking about the synthesis that you can see in this figure. Number 1, L-tryptophan by hydroxylation to give 5,5-hydroxytryptophan. It is decarboxylated again to 5-ST. Complete synthesis you can see in the figure number 2, that is synthesis and degradation of 5-hydroxytryptamine. Serotonin mostly present in GIT, platelets, CNS and pineal gland. It acts as a precursor to melatonin. Now we will discuss about the mechanism of action. 5-HT1 receptor inhibit adenyl cyclase and decrease cyclic MP in CNS. 5-H2 receptor linked to PLC rising IP3 and DAG linked levels in smooth muscles, levels, platelets and CNS. 5-HT3 receptors linked to membrane ion channels, sensory and interact nerves. 5-HT4 receptors increase cyclic MP, interact nerve, CNS and in smooth muscles. 5-HT, 5, 6, 7 and 8 unknown, basically present in CNS. Dear friends, now we will discuss about the pharmacological actions. Vasoconstrictions of renal, pulmonary and cerebral vessels. Vasodilation of skeletal muscles and heart blood vessels. Weak inotropic and chronotropic effects. Smooth muscles, contraction of smooth muscles in GIT, bronchial tree and uterus. Weak bronchoconstriction. Stimulation of sensory nerve endings may include pain, itching sensation. In CNS, it is responsible to control mood and temperature, inhibit appetite, anxiety, induction of vomiting, migraine and carcinoid syndrome and anxiety. Serotonin antagonists, basically these are the main examples. Sumatriptan, it has no CNS effect, treat migraine attacks. Buspirone and ipsapiron, partially 5-HT1A agonists, anxiolytics in anxiety disorders. Dexafenfluramine stimulate 5-HT release, appetite suppressant. Urapidil, it is HT1A agonist, decrease centrally sympathetic tone and increase vagal tone, used to control blood pressure. HT reuptake inhibitors may include fluoxetine and paroxetine. They are useful as antidepressant drugs. Now we are discussing about the serotonin antagonists. It may include cyproheptadine and peractin, that is 5-H2 antagonists, histamine H1 and muscarinic antagonists, carcinoid tumors, pizotifin, similar to cyproheptadine, appetite stimulation, methyl sergide. It is basically a 5-H2 antagonist used in migraine prophylaxis. Carcinoid tumors, ondansetron and granisetron. They are basically 5-HT3 antagonists, block vomiting centers and CTZ. Antiemetics may include metoclopramide, block 5-HT3 receptors. It may also use as an antiemetic action, blocks dopamine receptor antiemetic action, stimulates cholinergic system prokinetic. Ketanserin block 5-H2 H1 alpha 1 receptors. It may cause hypertension. Now we are discussing about the carcinoid tumor, that is malignant tumor in enterochromaffin cells of GIT. Features are bronchospasm, GIT, diarrhea, colics, flushing of the face. Diagnosis, you can see high plasma level of serotonin, high 5,5-H1AA in urine. Now we are discussing about the treatment. Treatment may include cyproheptadine and methyl sergide. In case of ergot alkaloid formed by the fungus, act on several receptors, dopamine, 5,5-HT and beta 1 receptors. Pharmacological action. In case of CNS, stimulate dopamine receptors and decrease prolactin. Treatment of Parkinsonism disease, stimulation of cerebral vessels by a 5-HT2, and in case of smooth muscles, it may cause vasoconstriction of blood vessels, contraction of uterus. It may also induce nausea, vomiting and diarrhea as a side effect. Now we are discussing about the types and uses. Migraine treatment. Ergotamine and dihydroergotamine basically responsible to block 5-HT1 and 5-HT2. Migraine prophylaxis. In this we can use methyl sergide, act on 5-HT2, postpartum. In case of hemorrhage, ergometrine and ergonovine. In case of Parkinsonism disease, we can use bromocriptine as a dopamine agonist. Now we are discussing about the side effect. A condition called ergotism may include the symptoms nausea, vomiting, diarrhea and severe vasospasm, gangrene, confusion and weak pulses. Ladies and gentlemen, now we are discussing about the module second, that is Autacoids second. It may include prostaglandins, thromboxins and leukotrienes. Prostaglandins and leukotrienes are biologically active derivatives of 20 carbon atom polyunsaturated essential fatty acids that are released from cell membrane phospholipids. They are the major lipid derived autocoids. In case of figure number 4, you can see the biosynthesis of prostaglandins, leukotrienes. Less active metabolites are shown in italics, that is thromboxane and prostacyclin. As you can see in the figure number 5, now we will discuss about the cyclooxygenase, that is COX, is wound to the endoplasmic reticulum. COX exists in 3 isoforms, that is COX1, known as constitutive, act as physiological condition. COX2, it is inducible, is induced in inflammatory cells by pathological stimulus, and COX3 is basically present in the brain. It is believed that eicosanocytes produced by the COX1 participate in physiological function also known as housekeeping function, such as secretion of mucus for protection of gastric mucosa and maintenance of renal function, while those produced by COX2 lead to inflammatory and other pathological changes. Now we come to the lipooxygenase pathway. Appears to operate mainly in the lungs. WBC and platelets, its most important products are the leukotrienes generated by 5 blocks, particularly LTB4, potent chemotactic, and LCT4, LTD4, which together constitute the slow reacting substance of anaphylaxis. That you can see in the figure number 6, aspirin-like drugs inhibit mainly COX1 and can cause peptic ulcer, GI bleeding, bronchial asthma and nephrotoxicity. In figure number C, you can see different types of leukotrienes. Now we come to the action and pathophysiological of prostaglandins and thromboxins and prostacyclin. The cyclic eicosanocytes produce a wide variety of action depending upon the particular PG or thromboxane or prostaglandin species on which tested, tissue, hormonal status and other factors. PGE2 and PGF2 alpha causes vasodilation in most but not all vascular beds. PGI2 is uniformly vasodilator and is more potent hypotensive than PGE2. Thromboxane A2 consistently produces vasoconstriction. PG endoperoxides G2 and H2 are inherently vasoconstrictor, but often produce vasodilation or a biphasic response due to rapid conversion to other prostaglandins, especially PGI2 in the blood vessels themselves. Thromboxane A2, which can be produced locally by platelets, is a potent inducer of aggregation and release reaction. On the other hand, PGI2 generated by vascular endothelium is a potent inhibitor of platelet aggregation. Dysmenorrhea in manly women is associated with increased Pg synthesis is by the endometrium. PGF2 alpha, PGD2 and thromboxane A2 are the potent vasoconstrictors, more potent than histamine, while PGE2 is a powerful bronchodilator. PGI2 produce mild dilation. PGE2 and PGI2 increase water, sodium and potassium excretion and have a diuretic effect. PGE2 has been shown to have a furosemide-like inhibitory effect on chloride reabsorption as well. They causes renal vasodilation and inhibit tubular reabsorption. PGE2 and PGI2 produced mainly by COX-2 in the kidney appear to function as an internal regulations of blood flow as well as tubular reabsorption in the kidney. Dear friends, till now you have gained a complete idea about the autacoids, their classification and role in our body. If you have missed any of the module or content, you may log on to our website, that is www.cec.nic.in, to download videos, FAQs, LOR and other content so that you can remain updated with this chapter. Now we come to the module 3, the category of autacoids. It may include angiotensin, pentagastrins, cholecytokinin, bradykinin and substance P. First we will discuss about the angiotensin. So my dear friends, angiotensin is a peptide hormone that causes vasoconstriction and a subsequently increase in blood pressure. It is a part of the renin-angiotensin system, which is major target for drugs that lower blood pressure. Angiotensin also stimulates the release of aldosterone, another hormone from the adrenal cortex. Aldosterone promotes sodium retention in the distal nephron in the kidney, which also drives blood pressure up. Angiotensin is an oligopeptide and it is hormone and a powerful adaptogen. It is derived from the precursor molecule angiotensinogen, a serum globulin produced in the liver. It plays an important role in the renin-angiotensin system. Now we will discuss about the types of angiotensin, that angiotensinogen. Angiotensinogen is an alpha-2 globulin produced consistently and released into the circulation mainly by the liver. It is a member of the saccharin family, although it is not known to inhibit other enzymes. Unlikely most terpenes, plasma angiotensinogen levels are increased by the plasma corticosteroids, estrogen, thyroid hormones and angiotensin second level. Now friends, we will discuss about the angiotensin first. Angiotensin first is formed by the action of renin on angiotensinogen. Renin cleaves the peptide bond between the leucine and valine residues on angiotensinogen, creating the 10 amino acid peptide DASASP angiotensin first. Renin is produced in the kidney in response to renal sympathetic activity. Angiotensin first appears to have no biological activity and exists solely as precursor to angiotensin second. That you can see in the figure number 1, role of angiotensin first and role of angiotensin second in CBS. In figure number 9, you can also see the effect of angiotensin converting enzyme inhibitors. The reduced retention of sodium and water result from two causes: decreased aldosterone production and release, and to decrease angiotensin second, which acting on the kidney increase sodium reabsorption. Now we will discuss about the angiotensin second. Angiotensin first is converted to angiotensin second through removal of two C-terminal residues by the enzyme, that is angiotensin converting enzyme, also known as ACE, primary through ACE within the lung but also present in endothelial cells and kidney epithelial cells. ACE is a target for inactivation by ACE inhibitor drugs, which decrease the rate of angiotensin second production. Angiotensin second increase blood pressure by stimulating the G protein in a vascular smooth muscle cell, which in turn activate an IP3 dependent mechanism leading to a rise in intracellular calcium levels and ultimately causing contraction. In addition, angiotensin II act at the sodium hydrogen exchange in proximal tubules of the kidney to stimulate sodium reabsorption and hydrogen excretion, which is coupled to bicarbonate reabsorption. This ultimately results in increase in blood volume and blood pressure. Hence, ACE inhibitors are major antihypertensive drug. Angiotensin II is degraded to angiotensin III by angiotensinoids located in red blood cells and the vascular beds of most tissues. It has a half-life in circulation of around 30 seconds, whereas in tissue it may be as long as 15 to 30 minutes. Now we will discuss about the angiotensin III. Angiotensin III has 40% of the pressure actively of angiotensin II, but also 100% of the aldosterone producing activity increase mean arterial pressure. Now we will discuss about the angiotensin IV. Angiotensin IV is a hexapeptide that, like angiotensin III, has some lesser activity. Now we will discuss about the effects of angiotensin. Angiotensin II, III and IV have a number of effects throughout the body. First one we will discuss in cardiovascular. They are potent direct vasoconstrictors, constricting arteries and veins and increase blood pressure. In case of neural, angiotensin II increase thirst, sensation, diapsogen through the subfornical organ of the brain, decreases the response of the baroreceptor reflex and increase the desire for salt. In case of adrenal glands, angiotensin II act on the adrenal cortex, causing it to release aldosterone, a hormone that causes the kidney to retain sodium and lose potassium. Elevated plasma angiotensin II levels are responsible for the elevated aldosterone levels present during the luteal phase of the menstruation cycle. In case of renal, angiotensin II has a direct effect on the proximal tubules to increase sodium reabsorption. Increase in systematic blood pressure will maintain renal perfusion pressure. However, constriction of the afferent and efferent glomerular arterioles will tend to restrict renal blood flow. Now we will discuss about the substance P. This is the another category of autacoids. Substance P is an undecapeptide, a peptide composed of a chain of 11 amino acid residues, member of the tachykinin neuropeptides family. It is a neuropeptide acting as a neurotransmitter and as a neuromodulator. Substance P is a key first responder to a most noxious and extreme stimuli. Stressors. Function of the substance P. Vasodilation. Substance P is a potent vasodilator. Substance P induced vasodilation is dependent on the nitric oxide release. Substance P is involved in the axon reflexes mediated vasodilation to local heating and wheel and flare reactions. It has been shown that vasodilation to substance P is dependent on the NK1 receptor located on the endothelium. In case of inflammation, we will discuss about the role of substance P. Initiate expression of almost all non-immunological and chemical messengers, cytokines. Also, most of the cytokines in turn induce substance P and the NK1 receptor. Substance P is particularly excitatory to cell growth and multiplication by unusual as well as oncogenic driver. SP is a trigger for nausea and emesis. Substance P and other sensory neuropeptides can be released from the peripheral terminals of sensory nerve fibers in the skin, muscles and joints. In case of pain, substance P has preclinical data supported that substance P is an important element in pain perception. The sensory function of substance P is thought to be related to the transmission of pain information into the central nervous system. Substance P coexists with the exciting neurotransmitter glutamate in primary afferent that respond to painful stimulation. In case of mood, anxiety and learning, substance P play major role. Substance P has been associated with the regulation of mood disorders, anxiety and stress, reinforcement, neurogenesis, respiratory rhythm, neurotoxicity, pain and nociception. In case of vomiting, the vomiting center in the medulla called the area postrema contains high concentration of substance P and its receptor in addition to other neurotransmitters such as choline, histamine, dopamine, serotonin and opioids. Their activation stimulates the vomiting reflexes. Different emetic pathway, exit and substance P, NK1R appears to be within the final common pathway to regulate vomiting. Now, we will discuss about the role of substance P in cell growth, proliferation, angiogenesis and migration. The above processes are the part and parcel to tissue integrity and repair. Substance P has been known to stimulate cell growth in normal and cancer cell line cultures, and it was shown that substance P could promote wound healing of non-healing ulcer in humans. Substance P and its induced cytokinins promote multiplication of cells required for repair or replacement, growth of new blood vessels. Now we come to the summary. With all these information, here we come to the end of today's lecture. We have discussed all the aspects of local hormones as autacoids, including their location, function and significance in our body. This lecture attempts to give students detailed learning regarding the different autacoids. Do keep in mind what we have discussed today. This is the time for your self-study. We hope content of this lecture will help to students and teachers of pharmacology at great extent and will help them to deepen their knowledge. If you want to learn more for enhancing your knowledge, you may log on to our website, that is www.cec.nic.in for MCQs, quiz and LORs. Till then, keep studying. Goodbye.